Welcome to Wednesday's edition. The daily tally has risen today to above 400 as we mark 1 year since Korea's first reported infection. Now, since then, the country has secured quite a bit of attention for its effective containment of the pandemic amid advances in its medical biotechnology. Elsewhere, the U.S. is poised to see a new administration in power amid the pandemic. First up then, Soa, to start us off with the COVID-19 updates for here in Korea.
Yes, Sunny, there's been a rise in cases compared to the past 2 days. As this Wednesday, we are seeing 404 infections as of 12 a.m. And that's with domestic transmissions in the high 300s and 31 imported cases. And the average of daily infections in the past 7 days stands at 474, with the average of domestic transmissions in that same span in around the mid-400s. And that as we mainly had numbers in the 500s to the 300s in the past week. And with that, Korea in exactly a year has accumulated 73,518 infections. And the death toll today has hit 1,300 with 17 new fatalities. But we also have over 60,000 people who made a full recovery from COVID-19.
Right, so what is the government's latest assessment of the situation here in the country exactly a year after its first case?
Well, Sunny, authorities say that the country is recovering from its third wave of COVID-19 that had reached its peak back in late December. And the government is also confident that through cooperation with the nation's people, Korea can overcome its current situation as it has done during 2 earlier big outbreaks, one centered in Daegu in February and also one in August in the metropolitan region. So here's part of an assessment of the government at an earlier briefing this morning.
All people of this nation can be proud for sticking to the principles of our response to the outbreak based on the foundations of democracy, transparency, and openness.
And also, while thanking citizens for practicing strict social distancing, Yoon also warned that we still have to be on alert, also citing movement data here in the metropolitan region. It is still dealing with triple-digit figures here, Seoul and Gyeonggi-do province, and also a handful of other places with double-digit figures of new infections. And now let's also take a look at the international updates. We have the U.S. The new administration will have to deal with almost 25 million COVID-19 infections, and also the death toll has surpassed 411,000. Then we have the UK here. There's been a decline here in daily infections now at around 30,000 after the COVID-19 variant in recent weeks even led to over 50,000 new infections in a day. But the UK also now has over 90,000 fatalities. Meanwhile, Italy with resurgences has surpassed the number of cases in Turkey, and also Indonesia here with some 10,000 cases on a daily basis recently has now more total infections than the Netherlands. And with that, the global tally now stands at 96.6 million and daily deaths now at around 16,000. And those are the updates I have for now. I'll be back with more tomorrow. Sunny?
All right, so thank you for that. Over in the U.S., President-elect Joe Biden is poised to take the reins of the White House at noon on Wednesday in Washington, D.C. local time, which would be the very early hours of Thursday morning here in this part of the world. Now, for more on the upcoming inauguration, I have Caroline Persuti live on the line. Good to have you with us, Caroline.
Thank you, Sunny. Good to be with you.
Right, Caroline, do start by telling us a bit about the atmosphere there ahead of the inauguration.
Well, it's a very different atmosphere than we normally have here. You know, up to 1 million people usually attend the inaugurations. That's how many were present during Barack Obama's inauguration. But this year, it's virtually all virtual. Everyone is encouraged to stay home. Everyone's encouraged to watch on television. And of course, that's because of the recent Capitol riots that we had on January 6th. And downtown, as you can see in that video, is simply a fortress. We have 3-meter high fences topped with razor wire. We have 25,000 National Guard troops joining state, national, and local police officers who are making sure that everyone is secure, that everyone is safe. Now, by what I mean by everyone, that includes the legislators who will be with Joe Biden when he takes his oath of office in front of the Capitol. They are the only ones who will be present in that secure area.
I see. Carolyn, I hear that preparations for rehearsal were briefly interrupted amid a fire nearby, and the Capitol complex was also briefly closed down.
That's how on guard everyone is. Everyone is on edge, and as soon as you hear anything about this was a smaller fire, it was actually caused in a homeless tent, which was about a kilometer away from the Capitol. But nonetheless, everyone is very aware that something could happen at any time. And so that's why we have so many law enforcement officers on hand. And it will be an inauguration like none other.
Right. Caroline, once sworn into office, Mr. Biden will give his inaugural speech to set the tone for his term in office. What is expected to be included in his address?
Well, number one for Joe Biden will be to unite this country, right? How do we move forward? We are certainly a divided country when it comes to different political views. We have 74 million people who did vote for President Trump to give him a second term. So it's those 74 million that the new president, President Joe Biden, will have to appeal to. He needs to unite this country so much that we heal, that we understand, that we are tolerant of other opinions. And also, we have to stop the violence. So the new president will have an uphill battle here in this country. And on top of healing a nation, he will also have to deal with the coronavirus. As you mentioned, our numbers are extremely high in this country. I heard your numbers are 400. My goodness. That is so low compared to the United States. So coronavirus will be on the top of his list as well.
Right. Meanwhile, now, Mr. Trump stands to become the first president after Andrew Johnson to skip the inauguration of his successor, and that happened back in 1869, I understand. Tell us a bit about Mr. Trump's upcoming departure from the White House.
It's very unusual. Now, tonight he did record a video message. That was his farewell message to the public, in which he did wish the new administration well, but he did not refer to Mr. Biden by name. Now, tomorrow morning, morning here, which is 8 hours from now, the president and Melania Trump will leave the White House, and they will go to the airport and they will fly to Mar-a-Lago. Now, keep in mind, our Constitution, the 20th Amendment, says that there will be a new president in 12 hours from now. So that means President Trump can fly on Air Force One because he will be the president when he gets on board that plane. But he has to land before 12 hours from now, noon our time, in order for him to be on Air Force One. Otherwise, he can't be on that plane. So when he lands in Florida, then he will no longer be president. And then at that same time, here in Washington, Joe Biden will be taking the oath to become the new president.
Right. Caroline, there was a poignant lighting ceremony on the eve of the inauguration in memory of the lives lost to COVID-19. Could you tell us a bit about that, please?
It was beautiful. You know, there is no one allowed on our National Mall right now because of the security concerns. So you have this enormous expanse of land. You can see it right there with the beautiful water in between. And there is no one there. But tonight, there were 400 lights lining the water, just gorgeous lights like luminaries for our holidays here. And Joe Biden spoke to the crowd. Someone sang before he spoke, and it was a COVID nurse. And he said, nurses are angels because nurses are the ones who are courageous and they absorb everyone's pain. He also talked about how he will control the coronavirus. And he said, to heal, we have to remember, and to remember is hard. But that was a beautiful eve before the inauguration event. And you know what? I want to show you something. I was looking through some old papers. These were my inauguration credentials when I attended another inauguration. And that's how many events we could attend as journalists. Now we have 2 credentials. So how many here? 1, 2, 3, 4, 5, 6. So that's it. And that shows you how many events are not open to the public, not even open to journalists. We used to end the evening in our inaugurations here in this country with enormous balls. There were balls all over town in Washington, D.C. that you could attend, that you could pay to attend. And everybody would talk about which ball are you going to? And everyone would dress up in their black ties and their gowns. No balls this year, all online.
Right, unfortunately. Carolina, you mentioned the pandemic being a priority for the incoming Biden administration. Has anything been shared about the exact measures that will take place once the new office starts?
When a new president starts his term, we usually refer to his first 100 days in office, and we really keep an eye on what his priorities are then. For Biden, it will be the COVID stimulus plan. He is introducing a $1.9 trillion plan to Congress, and that will include a $1,400 payment to Americans to help them get through this point, get through this economic downturn. He is also saying in his first 100 days, he will give out 100 million vaccines. That is an enormous goal to reach, and that is all part of that stimulus plan that Congress will take up. Also, Congress will also be approving his cabinet members. Because of the problems with the transition and that President Trump didn't cooperate with that, he has not had any of his cabinet members approved yet. And so that will also be a priority so that he can get down to business on day one.
Right. Carolyn, one final question before we let you go. Aside from matters related to the pandemic, what else stands at the top of Mr. Biden's agenda?
Well, another thing that he will be doing is immigration. He has talked about paving a way for people to get citizenship, the people who are here undocumented. So those are millions of people who have arrived in this country illegally, and he is saying that there will be a path to citizenship. He's also going to erase some corporate taxes. He's going to, there's talk about him erasing the travel ban for many Muslim countries. So a lot of the things that President Trump has put into effect, Biden will be issuing executive orders to fall back on those, to pull those back, or to eliminate those.
I see. All right, Carolyn, thank you very much for making the time to join us live with your thoughts at this hour.
My pleasure. Nice to be with you.
Right. A year ago on this particular day, Korea confirmed its first COVID-19 case. Now, since then, dramatic changes have taken place in our daily lives. And for more on this new normal, I have Kim Hanul here in the studio with me. Welcome, Hanul.
Good afternoon.
Now, surely any talk about change amid the pandemic needs to start with face masks, Hanul.
That's right. So face masks have become almost like second nature to us, and you wouldn't imagine leaving your home without wearing a mask. And mask supplies are plentiful now, but at the beginning of the pandemic, people were panic buying masks amid shortages. Early last year, you might recall standing in long lines in front of a pharmacy store or searching door to door to buy a face mask. In February, Daegu and Gyeongsang-buk-do province became the epicenter of Korea's first wave, linked to Shincheonji Church. At the time, surgical masks were in short supply and prices skyrocketed, prompting the government to enforce a mask rationing system in March. Under the scheme, citizens were allowed to buy a limited number of masks each week for roughly $1 each. The rationing system ended in July as supply finally caught up with demand. Although people have complied with mask-wearing rules for the most part, some have not, with the government deciding in November to fine people who fail to wear a mask at public use facilities. Violators face a fine of up to 100,000 won, or around $90.
Right. And the QR code-based check-in process has become the cornerstone of safe access to many venues, right, Hannah?
Right. So QR codes have actually been around for more than 3 decades in the manufacturing industry, but it really stepped into the limelight during the pandemic as an effective contact tracing tool. The country witnessed a fresh wave of COVID-19 cases in May linked to nightclubs and bars at the nightlife district of Itaewon. The crisis was aggravated by ineffective contact tracing, as some people wrote down false names and contact information on pen and paper visitor logs. That's why Korean health authorities decided to make the QR code entry logs mandatory starting in June at facilities deemed to be especially vulnerable to cluster infections. Venue operators who fail to keep a QR code register face a maximum fine of 3 million won or a suspension of their operating license. To allay privacy concerns, the government said personal data collected through QR codes will be encrypted and discarded after 4 weeks.
Now, Hannah, perhaps a silver lining amid the pandemic is the booming business of delivery services.
Right, and delivery food services were already popular in Korea before the pandemic, and the country is home to the world's third largest food delivery service market. And amid tighter social distancing rules and more people working from home, delivery food sales have exploded in the past year. Data from Euromonitor estimates that Korea's food delivery service market grew 40% in 2020. According to a local data analytics firm, Mobile Index, the number of users on Korea's leading food delivery app, Ua Brothers, rose 24.5% in 2020. Its competition, Coupang Eats, saw a tenfold increase in its number of users from January to December 2020.
Oh, wow, tenfold, including me probably. Now, meanwhile, going out in big groups is currently a thing of the past.
Right, and the way we connect with people has also changed drastically as the ban on all private gatherings of 5 or more people has been in effect since December 23rd. This came in light of the country's third wave in December, with more than 1,200 people testing positive on Christmas Day, setting a record daily high. The gathering ban changed the landscape of year-end celebrations, forcing many people to spend their holidays in very small groups. Working lunches involving more than 4 people were also not allowed, while alumni meetings, housewarming parties, and birthday celebrations had to be canceled. This hasn't stopped people from touching base with their friends, however, with Zoom and video calls now taking place of face-to-face meetups.
All right, Hannah, as always, thank you very much for that coverage.
Thanks for having me.
Right, now, as Hannah just mentioned, a growing number of people have been dining at home amid the pandemic, and the trend that is has led to much popularity of meal kits. Now, these kits include pre-portioned ingredients and recipes that make cooking as easy as pie. Do take a look.
Open the kit, then you will find all the ingredients you need to make a delicious meal in exactly the right proportions. Meal kits are paired with easy-to-follow recipes. If you do as instructions say, you will make a bowl of stew as well as a bowl of fried rice quite easily.
It used to take 30 minutes to cook all this, and now 10 minutes, that's all you need. It's been already a year since the COVID-19 pandemic broke out, and from that, demand for meal kit has received a huge boost.
Before the pandemic, meal kits were particularly popular among those in their 20s and 30s, and the market has expanded significantly for the last 1 year as meal kit purchases among people in their 50s soared.
삼시세끼를 다 차려야 하는 그런 일들이 벌어지다 보니까 초반엔 다 집밥으로 해결하려는 노력을 되게 많이 했는데 사실은 이게 거의 1년 동안 계속됐잖아요. 이제 그러다 보니까 굉장히 빠르게 이제 요리라든지 이런 것들을 조금 대체할 수 있는 중식류들, 간편식류 이런 것들에 대한 활용이 많이 늘어나면서 뭐 HMR이라든지 밀키트라든지 이렇게 조금 집밥을 보완 대체해 줄 수 있는 그런 요소들을 굉장히 많이 활용을 하고 있는 것들이 특징입니다.
This is an offline store for a meal kit company. It achieved sales of about 40 billion Korean won last year by posting various quick and easy recipes online.
집에서 해먹기가 번거로우니까 그냥 이런 거 사서 그냥 금방 뚝딱뚝딱 해먹으니까 그래서 많이 사는 것 같아요.
집에 이제 재택하는 경우가 많고 또 하나는 이제 싱글들 같은 경우에도 예전에는 이제 회사에서 집밥이 아니라 회사 식당 혹은 주변 식당에서 이제 먹는 경우가 굉장히 많아졌었는데 지금은 그 짧은 점심시간 동안 본인이 밥을 해서 차려서 먹어야지 되는 그런 경우들이 굉장히 많아지기 때문에 밀키트라든지 혹은 HMR 같은 것들을 굉장히 많이 활용하는 것 같고요.
So the store was originally designed to attract more customers by giving them a sense of what the company's products are like. But then it gained so much popularity, so the company decided to expand its offline stores. And there's something that makes the store more special, and that is people can actually taste the meal made with the kit.
Online shopping seems much more convenient, so why would people rather visit here?
괜찮은 것 같아요. 이렇게 개별로 반찬도 나오고 저기도 구경하고 원하는 거 있으면 살 수 있고 해가지고 좋은 것 같아요.
Since the pandemic, the number of people purchasing meal kits has doubled, and that has facilitated many meal kit companies to develop various recipes.
So what would you consider when purchasing a meal kit? It should be easy to cook and should make a delicious meal. So the company is now working on developing various meal kits and convenience food to meet demand from its main consumers.
코로나 바이러스가 이제 발발한 이후에도 사람들이 꾸준히 집에서 이제 좀 소중한 한 끼를 더 많이 챙기려는 경향이 생기는 것 같다고 생각합니다. 저희도 그래서 내부에 이제 인력 보충이라든지 기타 역량 강화를 통해서 올해 안에 더 많고 이제 새로운 제품들을 출시해서
The COVID-19 pandemic is changing not only our lifestyle but also our eating habits. Massive growth has created a fertile market for meal kits, and the market is expected to grow even further. This has been 신세병.
우리의 방역 시스템과 경험, 임상 데이터, 진단키트를 비롯한 우수한 방역 물품 등은 세계적으로 인정받고 있습니다. 메이드 인 코리아의 위상이 더욱 높아졌습니다.
January 20th marks the day Korea reported its first case of COVID-19 as a Chinese traveler tested positive upon arrival into the country. Now, since then, there has been much attention on Korea's strategy against the pandemic, including its medical biotechnology. For more on this, I have Dr. Alice Hyung-Tan from Ms. Medi Women's Hospital. Welcome back, Dr. Tan.
Thank you.
I also have Dr. Son Ho-jun from Johns Hopkins University. Good to see you again, Dr. Son.
Hi, Sunny. Thanks.
Meanwhile, joining our talk virtually is Dr. Claudia Dankinger from Heidelberg University. Pleasure to have you with us, Dr. Dankinger.
Thank you for having me. Good morning.
Right, Dr. Dan, let's begin with your assessment of what appears to be a declining trend with regard to third wave here in Korea and perhaps factors behind the falling tallies.
Right, I think we're in a bit of a transition stage right now. So we're 1 month prior to vaccine rollout. We're on the downward slope of the worst wave so far of COVID-19 in our country. And we're about 2 weeks away from the biggest holiday, most important holiday in Korea, Lunar New Year. And so there are a lot of moving factors right now. In terms of where we're at here, January, we're 2/3 through the month, and unfortunately, January has already proven to be the deadliest month for COVID-19 so far. We've seen 400 fatalities, and we're only 2/3 through the month. The outbreak at the BTJ Center in Sangju City is proving to be very difficult to control. And unless we get the kind of cooperation and compliance that we need from the members of this group, we could see hundreds of more cases because of this one outbreak. In terms of the elements that led to our successful passing of the peak of this third wave, I think there are 4 different elements. The first was the testing strategy. We expanded our testing. We literally took testing to the streets with the temporary testing centers that were set up in the Seoul metropolitan area. We were able to detect more than 3,000 positive cases from these temporary testing centers. We also performed aggressive targeted testing at the high-risk nursing homes and convalescent hospitals around the Seoul metropolitan area. We did stricter social distancing, of course, with the ban on gatherings of more than 5 people or above. And this came right before the Christmas and New Year's holiday. And I think that was very effective in preventing the kind of surge, post-holiday surge that we're seeing in the United States and in Europe. Also, I think news of the new mutations really shook people out of sort of the compliance maybe and the sense of security that they were feeling, and it made people much more on high alert, and I think that's what we needed for this third wave. And then finally, the facilities and hospitals, doctors, nurses, they really stepped up to make the surge capacity that we needed to isolate and treat all of our patients from the third wave. So it was a comprehensive approach that led to our successful passing of the peak, but of course we're not over this third wave yet.
Right, of course not. Meanwhile, Dr. Dan Kinger, as an expert on the outside looking into our country, what is your evaluation of Korea's COVID-19 response over the past year?
I have been impressed all along. I think Korea has done extremely well. I think early on Germany was lauded in Europe for its response, but it was certainly comparable by Korea already at the time. And Korea has continued to do well since then. And I think it's a combination of factors that Korea has done that made it so successful. I think it's a combination of tracing methods, using both classical methods, as we are here in Germany, but also more information technology. And I think there are lots more opportunities used in Korea than, for example, in Germany. Simply what privacy laws here in Germany don't allow some of these measures. But I also think it's a technology component that's very important here. Germany has very strong diagnostics industry as well, but Korea as well, and the combination of using both PCR methods and now also antigen-based methods to screen asymptomatic people in Korea, I think has served you very well, especially in the most recent wave. This is something where in Germany we are only trying to find our way how to apply these antigen tests on larger scale. And I think another important factor is where Korea really had foresight and did very well is that they enabled people who tested positive to isolate themselves. I think this was something that was not very well acknowledged in many countries around the world, that some people in our societies simply can't isolate themselves. And with the establishment of the community treatment centers and the like in Korea, there were opportunities for people to go and potentially isolate themselves. Here in Europe, what I have observed similar was, for example, in Slovakia with their mass testing, where they also gave the opportunity to stay at home, a paid leave from work. Those are efforts that are really complementary. And I think all of these efforts combined, the public health measures, the testing, the recognizing the people behind the positive tests and enabling to do as you tell them. I think all of this combined has made Korea so successful.
Right. Dr. Dan Kinger, like you mentioned, Germany had initially enjoyed quite a bit of praise, like Korea, for its response to the pandemic. Unfortunately, in recent days, cases have surged there, and I believe authorities have just agreed to extend their lockdown to mid-February. What do you believe was responsible for the change in COVID-19 situation over in Germany?
So I think our measures were simply overwhelmed. I think we still have a testing strategy that addresses the symptomatic patients, but our testing strategy does not look at the broader screening like what you are now doing in Korea. I think also it's biting us that over many years the public service, health service was decreased, was short on funding. And here I think we need to make investments again. And I think to some extent it's also the people are getting tired and the willingness to test is decreasing. I think it's very important that we pick people up where we can reach them with easy to go to tests and to also enable more simpler sampling methods with like anterior nasal sampling that's just so much more easy to tolerate, and potentially to consider testing at home for people, because I think the responsibility of people is there to respond accordingly. But right now, this is not being done, and I think with the numbers that we know now, with the 50% approximately of transmissions being due to asymptomatic, pre-symptomatic, or minimally symptomatic, we need to reach these people and make it easy for them to test. And that is currently not yet done.
Right. Dr. Son, aggressive testing continues to play a crucial role in containing the outbreak here in Korea. What is, first of all, the importance of diagnosis in tackling infectious diseases?
Right, thanks, Sunny. So both Dr. Tan and Dr. Claudia has already described in very detail and comprehensively the public health consequences or the benefits and the successes of massive testing and diagnosis, and how it has demonstrated how Korea was able to manage third, second, and now the third wave. So diagnosis is really important because it allows us to identify those who are infected, and from infectious pool to in the treatment pool, so that we have less people out in the society infecting other people. It's important, though, that diagnosis is a process, and Dr. Claudia has also mentioned, Dr. Tan mentioned as well, that contact investigations are important enablers for us to identify who are presumptively infected. Those are at a higher risk of being infected and being diagnosed, and it allows us to be more efficient in diagnosing and using the diagnostic tools. And then comes the diagnostic test, then to be able to accurately diagnose these people so that we are putting them on a proper treatment. And earlier diagnosis really has an important significance in public health, because not both public health and individual patients, because with the monoclonal antibodies, we know that these treatment has to be administered within 10 days, 8 to 10 days of infection. So people who are diagnosed earlier have a higher chance of having effective therapy and multiple therapy options, but also it means that we have less people putting on, more people putting on proper treatment, therefore less people dying, disease burden decreases, and less people in the population without their disease status known, so less infection going around.
Right. And staying on the topic of diagnosis, Dr. Dan, Korea's COVID-19 test kits garnered much attention, as President Moon Jae-in pointed out in the video we just saw. Are they still enjoying this recognition?
Right. Well, Korea's biomedical industry they played a very instrumental role in getting COVID-19 under control, both domestically and also around the world. There are at least 10 Korean biomedical companies that have received FDA approval for their in vitro diagnostics for COVID-19. And one of them, SD Biosensor, was actually the first company to win approval for the WHO emergency use list for its rapid antigen testing kit. And these approvals, I think they attest to the high performance and high accuracy of Korean diagnostics. Now, Elum is an Australian company, and they have developed the world's first FDA-approved, fully at-home, over-the-counter COVID-19 diagnostic kit. And I think this is a market, this is an opportunity for Korean diagnostic companies to go into, because certainly, as Dr. Claudia has said, this is an area of huge need, not just in Korea, but throughout the world, rapid at-home diagnostics. And so I think this is an area where Korean companies can really march forward and make inroads to helping the fight against COVID-19.
Right. And Dr. Claudia Denkinger, what COVID-19 testing method is widely used over in Germany? And given what Dr. Dan has just said, what is the meaning of the presence, or what meaning does the presence of diverse testing methods have on efforts to contain COVID-19?
Yeah, thank you for that question. I think probably the SD biosensor is actually the most widely used, followed probably by the CG and Alplex. In Germany, we use both of them here in the hospital. I was also part of the team that validated the SD biosensor to provide data to the WHO that led to its approval, and have been working with SD biosensor since March last year, so very early on in the pandemic, and continue to work with them also now thinking about self-testing. Not exclusively, obviously. My interest is to get the best test on the market. And SD biosensor has done very well. I have a few boxes here on my shelf because I use them myself for my personal use as well. And I think the diversification of testing is really paramount, because each one of these tests has essentially different use cases, and different advantages. And I think the PCR has its own right in diagnostics and will always have. We need the most sensitive diagnosis when we see a patient in front of us sick and we need to decide, do they have COVID or not? How do we go about the next steps, as Dr. Sohn said. The antigen tests, in my view, have a public health use case. They help us to be done frequently, close to the patient, so that we can break the infectious chain. And that is most important. And I think going towards even easier at home usable tests, I think will be a critical next step in order to do this even better.
Right. Meanwhile, Dr. Sohn, there has been some concern over the accuracy of the COVID-19 antigen test, especially when compared to the gold standard RT-PCR test. What are your thoughts on this?
Right. So as Dr. Denkinger has mentioned, I think that each test type has a purpose of its use, and it's important for us to understand what these purposes are and weighed against the accuracies. And also, accuracy is a really broad term that we normally kind of mix up on, so the general public don't understand the mixes between diagnostic sensitivity and specificity. Sensitivity refers, how you are able to accurately, the test is able to produce positive results on those who actually have the disease. Specificity is about the test producing negative results for patients who do not have the disease, right? And beyond that, there's other clinical indicators to measure diagnostic accuracies and the value of these tests. So it's really important to think in that term. And for the case of these antigen-based tests, I think the diagnostic accuracy in detecting and diagnosing active COVID-19 patient is definitely limited, and Korean Society for Laboratory Medicine has also weighed in on this, that the recently approved antigen-based test has a relatively low sensitivity, about 40 to 50%, which means that you will likely be missing 50% of the patients who are actually having the disease, so meaning that we're not breaking the infectious cycle. I think each test, and despite its challenges of accuracies, have different purposes and use, and we really have to think about and strategize what is most effective strategies to combine these types of products that we have available. And Dr. Claudia also referred earlier that we have to really think about which products we want to bring and advocate for their use. So these regulatory bodies are really working hard, including the WHO, to find these types of tests, and data is coming through, and we are busy at analyzing them.
Right. Dr. Dan, now moving beyond diagnosis, what are your thoughts on Korea's medical response to the pandemic, generally speaking?
Well, after testing comes triage, and then isolation, hospitalization, or treatment depending on the patient's condition, and that's the medical response that you're referring to. I think Korea's decision up front to place every positive case under some sort of monitored isolation was a very wise move, and that likely prevented hundreds, if not thousands, of additional cases, especially household transmissions. As of today, the case fatality ratio for COVID-19 in Korea is 1.77. And that's actually higher than the United States, higher than India, and higher than Japan. So I know it's perhaps misleading to draw large generalizations just from this one number alone, but I think that COVID-19 has exposed a lot of cracks and maybe deficiencies in healthcare systems around the world, and perhaps Korea is not an exception to that. I think there's no doubt that our frontline healthcare workers, the doctors and nurses taking care of the thousands of COVID-19 patients for a year now, 24/7 for a year now, that they have worked to their utmost and done the best that they could. I think in hindsight that we could have done better surge capacity preparedness in terms of hospital capacity and also personnel. I mean, just a few weeks ago, we were scrambling for adequate hospital beds, and we had to, make a massive recruitment effort to get more doctors and nurses to take care of our patients. And of course, this did lead to, I think, poor outcomes for many of the patients that were diagnosed as a result of this third wave. We also need to see a continued strong leadership that engenders strong cooperation between the private and public medical sectors. I think that's going to be very important, not just now, but going forward. And in terms of the medical response, of course, vaccine and treatment development are another part of what we need to do. We have, I think, 3 or 4 domestic vaccine candidates, but they are still in early phase trials. And we have one treatment that is in development, but the statistics from their phase 2 results have not been very robust. And so I think this is an area that we need to strengthen our infrastructure, the research and development of treatments and vaccines.
Right. Dr. Son, what is important in ensuring access to diagnostic technology for developing countries?
Right. So we've been looking for a lot of technologies recently for Korean companies to Korean researchers have developed high throughput, accurate molecular diagnostic tests. We want these type of easy to use molecular or accurate tests to be deployed in developing countries because their resources are really constrained, a lot more so than Korea. I know we are experiencing through a lot of resource constraints in the public health and in the healthcare sector, but we can imagine these are 10 to 200 times fold more. So placing and deciding what these cheaper, easy, highly accurate tests and easy to operate tests is really an important profile for for the developing countries. So in the TB world, we've explored GeneXpert, but we've been looking at the other technologies to implement. So I think strengthening diagnostic capacity through implementation and scale up of these easy to use molecular tests will be very important.
Right. Dr. Dan Kinger, earlier this week, German media reported that an unknown variant of COVID-19 had been identified among at least 35 hospital patients in Bavaria. Do you suppose the current COVID-19 testing methods at our disposal will continually serve to detect virus mutations?
Yes, I think it has to be evaluated for every new virus mutation to come, but in principle, most of the pressure for the mutations to occur is on the spike protein, which is the protein on the outside of the virus. And most of our PCR methods, or almost all of our PCR methods, don't target the spike protein to detect SARS-CoV-2. And if they do, they have multiple targets. So if one target drops, then the other targets pick up the virus. And this is, in fact, how the variant was identified in the United Kingdom. For antigen tests, also most of them detect another target, the nucleocapsid, which is, roughly speaking, on the inside of the virus. There have been a few mutations also with these variants on the nuclear capsid, but not on the target regions of the antigen tests. So I imagine also broadly speaking that the antigen test should not be affected, but I think it is on every test developer with every new dominant variant to prove in experiments, because can it happen? Absolutely.
I see. Dr. Dan, very briefly speaking, if we were to make a manual on responding to infectious diseases in the future, what should that manual include?
Well, fortunately, there are many manuals out there for pandemic response. I mean, the institution that Dr. Son belongs to, Johns Hopkins, they just published September 2019 an excellent manual on high impact respiratory pathogen pandemic preparedness. Okay. I think, though, right now COVID-19 is showing us that it's not just an initial response, it's a long-term response that is also very important. And in medicine, we talk about the biopsychosocial aspects of a disease. And it's not just the biological, like the disease impacts, but the psychological impacts, the social impacts, the economical impacts, and the political impacts. These all need to be incorporated, I think, in a manual going forward, because COVID-19 has shown us, we're exactly 1 year out from it coming into our country, but I don't know if we're even 1/3 of the way through COVID-19. We have a long way to go. And so looking long-term in terms of planning ahead, not just for the phase 2, phase 3 of COVID-19, but the next pandemic, which will undoubtedly come and hit our country at some point. We need to get ready for that.
Right. All right, Dr. Dan, as always, thank you very much for your insights. Dr. Sohn, thank you for making the time to travel here to see us at the studio. And over in Germany, Dr. Dan Kinger, thank you very much for making the time to join us live at this very early hour at your end.
Yeah, thank you for having me.
Right, now hopefully we'll see our fight against the pandemic end this year. In the meantime, do seek to abide by safety precautions against COVID-19, and thank you for watching.
COVID-19 has permeated our daily environment. In some cases, the